Doctor, they repeat vital signs. They're checking the patient. We do an AccuCheck. We're going to go through what the sugars were, but the AccuCheck here shows it's 550. It continues to be elevated. You saw that in the records?
Yes.
What does that tell you? We're still having, even though we've given her a bolus of insulin and we've given her this drip, what does the fact that her sugar levels continue to do say about her DKA?
Well, the best way I think I would explain it is we're not making much progress in reducing the amount of particles in her blood. So the insulin basically really didn't have much of an effect, and the fluids didn't have much of an effect.
Is DKA a serious disease?
Yes, very serious.
What percentage of patients proceed on to significant cerebral edema?
It's approximately 1%.
Of that 1%, how many die even with treatment?
It's got a high mortality rate, 30%, I believe, 25-30% roughly.
Doctor, they continue to repeat the vital signs. There's no changes for those. And they get a chest X-ray. Why do they do a chest X-ray?
Well, when a patient comes in, any critically ill patient, the signs of a experienced, good emergency physician is you still have to cast a wide net. You might think you have the diagnosis, but you still have to have an eye out and be broad. The second part of that is, in a DKA patient, something tips them over from just having high blood sugar, just like a diabetic can just have high blood sugar and not have DKA. Something usually tips them over, and many times it's an infection somewhere, some kind of an infection. And so, as the emergency physician, he can start looking to see, wow, is there some infection somewhere that I need to treat?
Doctor, in anticipation of the transfer, Dr. Till prints his chart and exam notes for the transfer. Is that appropriate and consistent with the standard of care?
Yes, it is.
Does the transfer team have a duty to ask for the chart and take the chart, the ambulance or the helicopter transfer team? Do they have a duty to take the chart?
It's a standard of care to have copies of the information from the hospital you are receiving the patient from to take back to the other hospital, yes.
And the receiving facility, if they don't get it, they can call and ask for the material if they want.
Scan, fax, yes.
Doctor, at 11:50, there's a nurse's note that indicates Shannon's resting. She's got deep respirations. Skin and nail beds are normal. The reports, the call is that St. Mary's helicopter is due in 10 minutes. We still have no headache, no nausea, no vomiting. Was there any additional care or different care that anyone at Indian River should have done in order to comply with the standard of care than what they did?
No, I don't see anything else they needed to do.
There continued to be no headache, no vomiting, able to arouse, no cortical posturing, no urinary continence, talking with the nurse, talking with the doctor, talking with the father, no heart rate. Did the standard of care require mannitol?
No, it did not.
And we've talked about the dangers of giving mannitol already, correct?
Yes.
Doctor, on pages 10 and 11, the jury will have the chart out, and it's got the numbers down at the bottom. Dr. Teal's examination is on page 10 and 11 in the chart, and I've highlighted those portions on the page that deal with his neurologic exam. When Shannon comes in, there's a couple of neurologic exams being done, one by the nurse and one by the doctor. Is there a difference in those neurologic exams?
Yes, there is. Usually the nurse is trying to gauge the severity of the patient's illness and deciding what resources need to be brought to bear on a patient when they come in. That's the whole idea of the triage and the nursing assessment. Also, the nurse is trained differently. Dr. Teal has more experience, more training, and the physician is going to do a more detailed neurologic exam.
You went through the findings that Dr. Teal had in his exam?
Yes.
Taking that constellation of findings, did that constitute clinically significant cerebral edema that should have led him to order mannitol?
No, it did not.